Hello, this is Ori Lotan, Chief Medical Information Officer with Crossings Healthcare Solutions. Thank you for joining us. We will briefly review our Opioid Advisor. In terms of background for this project, the CDC reports that more than 115 Americans die from opioid overdose every day. They further estimate that the economic burden, including healthcare, of the prescription opioid misuse in the United States exceeds $78 billion annually. As such, hospitals, health systems, and healthcare professionals are crucial players in the fight against this prescription opioid epidemic. Florida, in response to the growing opioid epidemic, has passed a strict law that impacts providers who prescribe controlled substances. Providers now face increased documentation requirements around type of pain, reason for administering an opioid, and duration of treatment. They must also currently prescribe an opioid antagonist for Schedule II opioids used for the treatment of pain related to certain traumatic injuries. Florida Opioid Law, as of July 1st, 2018, stated that for chronic non-malignant pain, there is no specific duration of therapy, but reassessment of patient should occur every 3 months. Care requires a patient contract and requires registration as well. In terms of acute pain, Class II opioids are to be prescribed with a max 3-day supply unless, quote, in the prescriber's professional judgment, a supply more than 3 days is medically necessary. They also have stipulated an acute pain exception. If a supply of opioids greater than 3 days is provided, it must be written on the prescription and the reason must be documented in the medical record. Additionally, non-acute pain must be written for any Class II prescription for, quote, non-acute pain, and every Class II prescription with a traumatic injury with a severity score of greater than or equal to 9 must be accompanied by a prescription for an opioid antagonist. Crossings Healthcare Solutions Custom Opioid Advisor was designed to make sure that providers are being compliant with Florida state law when a controlled substance is prescribed. Specifically, documentation of pain category on the prescription, be it acute pain exception, or chronic pain, documentation of reasons for prescribing in the electronic health record, documentation of diagnosis in the electronic health record, and since Florida state law mandates providers not to exceed a specific maximum duration for each category, the advisor has decision support to make sure the provider is prescribing appropriately. Allow me to demo the Opioid Advisor in one of our non-production domains. So in this case, we have a test patient. We're going to navigate over to the workflow M pages, to the discharge workflow M page, specifically the follow-up care orders, and you'll see that I have here a listing of prescriptions. We will go and select an opioid prescription for Percocet and place that order. When we do, after selecting an appropriate order sentence, the Opioid Advisor will automatically trigger. You'll see here that we have a link to the state-specific prescription drug monitoring program. So if you click on that link, it will take you to the appropriate site where you can enter your credentials and log in order to check the prescription drug monitoring program database. In addition, the advisor will have carried over the duration from my order sentence. This can be changed from within the advisor to any one of these options, and any changes that are done from the advisor will write back to the prescription. In this case, we will dispense 30 tabs. The type of pain is a required reason. The 3 options are acute pain exception, and non-acute pain. We'll select acute pain in this instance. And then the last required field is the opioid prescription reason. We'll put in hip fracture for this particular example. Once the required fields are completed, we can click Proceed. You will note that because this is an acute pain patient, we get the pop-up that acute pain is not allowed with a duration greater than 3 days. So we could go back and correct that to 3 days in order for this to go through. If I select an acute pain exception, you'll see that the naloxone order gets automatically selected, which is appropriate. Once I put in the dispense tabs and click proceed, we'll go to the scratch pad, and you'll see that all the details have been entered. When I click sign, the orders have been placed. If I want to go down to the orders profile, you'll see here that the prescription for Percocet has been placed, along with the acute pain exception and the indication that this is for a hip fracture. The naloxone order has been placed as well. If I want to look at the order details, when I look in order information, you'll see that the special instructions denote that this is an acute pain exception. This will get transmitted over to the pharmacy. In addition, the opioid reason has been indicated here in the EMR as a hip fracture. This does not get transmitted to the pharmacy, but is documented in the EMR, thus completing all the requirements around opioid prescribing. Thanks again for joining us for this overview of the Opioid Advisor.